Hey, Dr. G here, coming to you from the jungle in my backyard. So I have a jungle in my backyard, as you can see. This is sorghum, which is an African plant. How it got started in my backyard, I'm not sure. I thought maybe it was a weed. I let it grow, and it took over my yard. But I like it because I don't know, it makes me feel like I'm in the jungle. So I keep it. So today I want to talk to you a little bit about our healthcare system in the United States, how it is the most expensive healthcare system in the world, and yet Americans have some of the worst health in the world when you look at countries that are economically advantaged. So, you know, we have all the hygiene and the antibiotics and all that, but we still have bad health. And you might be asking, you know, why is that? We spend so much. We spend about 18% of our gross national product, and that's been slowly climbing over the decades. And so we spend all this money at the present time, or the last time they did data that I saw, we're spending over $11,000 per year per person. Every man, woman, and child in the United States is spending $11,000. So one thing I want to ask you guys is, you know, are you helping that curve or hurting that curve? So this may sound profound, but if you're healthy, you don't need to spend a freaking dime on healthcare. I don't. Like in the last 2 years, 3 years, I have not gone to the doctor one single time. Now, if I was sick, maybe I would go to the doctor, but I'm not. So I'm spending zero, except I guess I'm paying for my Medicare, Medicare policy or whatever you want to call it, which is costing me quite a bit, but I'm not spending anything outside of that. So I'm spending my Medicare premiums, but I'm not going to the doctor because I'm not sick. Why would I go to the doctor? I have no reason to go to the doctor. And the problem with the healthcare system is the reason it's so expensive is they're mining for patients. So they're mining for patients. And then something that happened a long time ago, medicine became a monopoly in the United States where, and this happened around the advent of antibiotics, where antibiotics were kind of a miracle cure. So they go, hey, you know, it was actually Rockefeller. He goes, hey, I can create, when he got his oil trust broken up, he wanted to find another thing he could monopolize. So he found healthcare. He goes, you know, with this new advent of finding chemicals in the lab and patenting them so you can sell them at high prices would be a good way to go. Trouble was there was all kinds of other practitioners that were practicing medicine, you know, homeopathy and chiropractic and all these different things. And he goes, well, first thing I got to do is run those other things out of business. So basically what he did was, you know, he paid for a report that Congress saw, and they go, oh yeah, we got to go to the labs and have prescription drugs. So they said, okay, the government-sponsored healthcare, and then it became the whole healthcare industry, cannot be covered by your health insurance. It cannot be any kind of alternative medicine. It has to be this mainstream allopathic, find a drug, patent it, and use that, and it'd be a miracle cure, and will cure everything. You know, we're starting with infectious diseases, which, if you go back to 1850, infectious diseases were the top 10 leading causes of death. All of them. Heart disease did not appear on that list. Well, heart disease is now number one. Do we have good treatments for heart disease? Well, we have statin drugs, which poison us to health. They reduce your heart attack percentage a little bit, but you don't live any longer, or maybe you live one extra day, you know, so they can say, well, you'll live longer, but it's only one day, and you have to have side effects. You know, statins have 300 different side effects, including pain being the most common one, depression another common one. it's not a good trade-off. There's probably better ways to lower your heart attack risk. In fact, I know there's better ways to lower your heart attack risk than taking a drug. So the antibiotics produce some miracles. The drugs for things like heart disease, Alzheimer's, neurodegeneration, autoimmune disease, the trade-off between the side effects and the benefit aren't so great. Autoimmune disease drugs, yeah, they cost a lot, and yeah, they can make your symptoms better. But wow, I got to risk cancer. I got to risk getting rare diseases, rare infectious diseases, because my immune system gets compromised. It's not a great trade-off. So $11,000 a year on average, but if you're healthy, you don't need to spend anything. The trouble with our system is, okay, a person is not going to understand something well when their salary depends on not understanding. So I apply that to the healthcare system, to the doctors and the hospital administrators and all that. What they're focused on is their salaries, and their salaries get bigger and they hire more people when we don't cure anything. If you don't cure anything, you keep your population sick, you keep them on your treatments, so you're a growth business, you're getting more and more business, you're hiring more and more people. You have a growth business, you're getting a greater percent of the gross domestic product each year. It's in the trillions of dollars per year now that we spend on healthcare. And as I said before, we're not making great progress against the diseases that are really harming us. The antibiotics, they don't even look for antibiotics anymore. They could care less how much of a miracle cure it is, because, that's not something sustainable. You cure someone, that's not sustainable. So if your salary depends on not understanding the cure, then, you're not going to look for it, because you're going to lose your job if you find the cure. So it's just human nature. So it's not the doctor's fault. I'm not coming down on doctors. It's just the system. We don't have the right incentives for doctors to keep people healthy, instead of let's get them on a bunch of pills. And the pills aren't miracle drugs like the antibiotics. And think about the antibiotics is we didn't stay on them. We took them and the infectious disease resolved, then we came off. But the drugs they want us on today, the cholesterol medicines, antihypertensive medicines, the drugs for Alzheimer's disease, the drugs for autoimmune disease, the drugs for osteoporosis, they want us on those things until we die. So they don't necessarily want us to die, because then they lose a customer. So it's kind of a balancing act that they're doing. Try to keep us alive, but even more important, keep us sick, so we're consuming, so they can build a bigger cancer center, a bigger heart center, a bigger digestive diseases center, a bigger psychiatry center, like a massive building with big windows and just beautiful with an atrium and a garden. I love these massive structures they build to the cancer industry, or, the cardiology center. It's kind of absurd that we, probably don't need all this. We look back, these diseases we face today were fairly rare back 100 years ago, 200 years ago. So we always say, well, the diet, we used to eat lots of animal fats and all these things, but that's what we used to eat before, all this modern crap. Electricity kind of was the beginning of indoor living, disconnecting with nature. So that's why I try to get connected to nature on a regular basis. So far from me, at 67 years old, today happens to be my birthday, but I may not post this today. May 1st was my birthday. So on my birthday, I'm thanking our Creator. I am so grateful. Our system, I don't blame anyone. I don't blame Rockefeller. He's just doing what he could do to amass his fortune. And it was probably meant to be, because it happened. So when things happen, they're probably meant to be. But I think we can, have a more sustainable medical system. We could have a medical system with the goal for us to be healthy and happy instead of the goal for us to be on drugs. So it's the matrix, kind of the dark side that wants to keep us consuming, wants us to feel inadequate, wants us to feel like, oh, I'm fearing getting cancer or getting some other disease. So I'm glad medicine's there for the, got the chemotherapy waiting for me. Save that chemotherapy, don't sell it to somebody else. Save it for me for when I get my cancer. Fear tactics are what they use. And it works, because if you fear cancer, you're much more likely to get it. And I will get off my soapbox right now. But you got to see my private garden. It's been great. I love you guys. Bye.